Hi everyone, Dr. Brian Steiner here at Wilkins Spinal Care in Mount Pleasant. So this week we're going to talk about neuropathy, which is another big service that we offer here at the practice. So what we're going to talk about is I'll talk about what neuropathy is real briefly. I'm going to talk about the nervous system a little bit because that's what neuropathy is affecting, is the nervous system. And then I'm actually going to bring you into the other room where we actually treat neuropathy patients. I'll explain what that is. I'll explain how we manage neuropathy patients, and I'll explain the program that we have here. So let's talk about neuropathy first. So neuropathy is broken up into two words, neuro and pathy. So neuro means nerve and pathy means disease. So that means neuropathy is a nerve disease. Now neuropathy has two different types. There's mononeuropathy and polyneuropathy. Mononeuropathy means when one nerve is affected, and polyneuropathy is when multiple nerves are affected. So in most neuropathy cases, more than likely in most cases, it's a polyneuropathy, so multiple nerves are affected. So what neuropathy does, there's pain, there's numbness, there's organ malfunction. These are all very common things that we see in neuropathy. Now, a lot of people say neuropathy is diabetics. Yes, it is a very common thing that we see. Now, there's over 200 different causes of neuropathy. The most common, actually, believe it or not, is not diabetic neuropathy. It's called idiopathic neuropathy, which means there's no known cause. There's just nothing has been inflicting the neuropathy. Now, there's also different causes, drug-induced malnutrition. Those are all common things that we see in neuropathy patients. So that's just a real quick brief synopsis of what neuropathy actually is. Now, I'm going to explain how neuropathy affects the nervous system. So in order to do that, I have our board here and it lights up. I'll push some buttons here. You'll actually see some cool things light up. There's three different parts of the nervous system: the central nervous system, the peripheral nervous system, and the autonomic nervous system. So the central nervous system, we've talked a little bit about, consists of the brain and the spinal cord. There's the spine there, and then these cords right here, these nerves, that's the spinal cord. So the central nervous system is like the delivery system. The central nervous system sends signals out to the body. So, and then whenever there's pain or if there's movement involved, that nerve sends a message back to the spinal cord, up to the brain, so that these functions can actually happen. Peripheral nervous system now. I'm going to push some buttons here for the peripheral nervous system. The peripheral nervous system consists of two different nerves, motor nerves and sensory nerves. Motor nerves allow us to move, sensory nerves allow us to feel and touch. Also involves cranial nerves. There's 12 different cranial nerves that allows to have functions, mainly in the face, but they also do some other things as well. And so let's explain that real quick. So peripheral nervous system. I'm going to push this white button here, and you'll see some stuff light up here, and I'm going to push this one here, you'll see some stuff light up here. So this is what we call the cervical plexus. So that light up right in there, all what's happening is running down all the way down the hands and fingers. So that's your cervical plexus. I'm going to push a button here. There's your lumbar plexus. That's what helps us control things in the hip, the leg, all the way down to the feet. Again, all these nerves run everywhere. So in most neuropathy cases, peripheral nervous system is affected because you start to have patients who have that loss of sensation, mainly in the feet. They have motor malfunction, but it also does affect organs as well, and that's where the autonomic nervous system comes in. So as you can see, these nerves are running into everywhere: the lungs, the stomach, the liver, bladder, kidneys, everywhere. Again, without the nervous system, we can't survive, because without the brain, we can't do anything. So the nervous system all works hand in hand all together. So I'm going to push right here, and this is what typically neuropathy patients see. See how everything's lighting up now? And then same thing up here. It's affecting everything, okay? So in neuropathy, you're going to have patients who have failure of everything. Sensation again, the motor loss, organs. Most patients that have an autonomic effect in the neuropathy case, they have a lot of loss of bowel control, a lot of loss of bladder control, or bowel movements, bladder, sexual malfunction, everything. So that is the gist of the nervous system. That's the gist of neuropathy. Now, I'm going to bring you into the room where we actually treat our patients, so you'll get a mini glimpse of our office here. It's pretty big, but our neuropathy room is right over here into the next room over here. So I'm going to actually explain to you what our program is and what we actually use to treat patients. But before I do that, let me discuss how neuropathy patients are typically treated in a medical facility. So they're going to be given drugs. There's a bunch of big names out there that people use. They're very hard to pronounce, so I'm not going to pronounce them for you. Injections. There are surgeries out there that help with neuropathy. These are things that are just numbing the pain. They're not actually eliminating the cause. That's our job here. We're eliminating the cause. So how our facility manages patients? First off, we do the same thing that we do with chiropractic and decompression patients. We sit down with them. We get to know them. And then afterwards, we do an examination, x-rays. And then after the examination, x-rays, that will determine, are you a chiropractic patient, or are you a decompression patient, or are you a neuropathy patient? Now, patients come to us and they have neuropathy issues. We take it one step further and do a more in-depth neuropathy test that's very simple. It does not take very long to do it all, but it's very in-depth, and it gives us a better understanding of how we need to treat the patient and the severity of your neuropathy. So this little machine right here is called Hockamed. It's a German-made machine, and it is essentially called horizontal therapy. Now, if you read my blog on Monday, you're probably going to see a lot of big terms, a lot of things that are very confusing, okay? So I'm going to bring this into a lot easier terms today. First thing, and I'm going to go very, not much in depth here, this is regenerating cells. And whenever there's regeneration of cells, that's what's actually bringing nerves back to life. Essentially, in neuropathy, nerves die. This is going to bring nerves back to life. And I can't tell you how many patients I've seen just in 4 years in practice here. I've seen patients respond extremely, extremely well to this therapy. So all you do is you hook the patient up. There's pads that go on them, whether it's on their hands, their feet, wherever the neuropathy's at. And it sends an electrical signal out, and it promotes generation of those cells. But how I'm going to explain it a little bit more, it's going to be a little bit easier and give you a better understanding. Picture your body as a cell phone, okay? When you're next to a cell phone tower, you have a very strong reception and very strong phone calls, text messages. As you get further away from that cell phone tower and you start going down a mountain or in a valley, you're going to lose that reception. Just like that cell phone reception, your nerves are not functioning properly, and as you get further and further away and you wait longer and longer, those nerves aren't going to get any better. This machine right here, there is no pain. All you're going to feel is a slight tingle. And again, it's a program, so it's not a one and done process, just like chiropractic, decompression aren't a one and done process. It wakes nerves up, but it does take time. Now, there's a lot of information that I had in that blog. There's a lot of information on neuropathy. I urge you, just like I urged you last week in decompression, if you know somebody with neuropathy, if you have neuropathy, call us. We can help you avoid surgery, we can help you avoid medications, and most importantly, we can actually help you live the life that you want to live. We can allow you to get up and walk again. We've had patients that are on canes and walkers come in here completely fine. We've had patients who've had organ malfunction and everything's responded well. It's not an easy process, and it's not a short process. It's a long process. So we want you to know we are here for you. We are here to help you. And if you have any questions, please don't hesitate to reach out to us. If you have any questions, give us a call, shoot us an email. We'll be happy to answer any questions for you. That's all I have for you today. I know it's a lot of information, but I assure you this can help you. So have a great day, and we'll see you in the next video.